So what is Crohn's disease? Crohn's disease is a chronic disorder that causes inflammation, irritation, and swelling of any part of the digestive tract, also referred to as the GI tract or gastrointestinal tract. Although it can involve any area of the gastrointestinal tract from the mouth to the rectum, among the GI tract, the most part commonly affected is the end part of the small intestine, called the ileum. The ileum is the final section of the small intestine, in which nutrient absorption and digestion occurs. Alternative names for Crohn's disease include granulomatous colitis, Crohn's enteritis, granulomatous enteritis, enteritis regional, ileitis, and ileocolitis. The disease is named after Dr. Burrell B. Crohn. In 1932, Dr. Crohn and two colleagues, Dr. Leon Ginsberg and Dr. Gordon D. Oppenheimer, published a landmark paper describing the features of what is known today as Crohn's disease. Dr. Crohn had a private practice in New York City and usually admitted his patients for diagnosis and treatment to the Mount Sinai Hospital. At Mount Sinai, he worked with the neurologist Bernard Sachs. He also spent time working with Jesse Shapiro, M.D., another doctor very involved with Crohn's research. Crohn built a very large and successful practice for patients with granulomatous enteritis. Through his research, he believed that a bacterium called Mycobacterium paratuberculosis, MAP, linked to the disease. 5 symptoms of Crohn's disease include diarrhea, abdominal pain and cramping, blood in the stool, ulcers, and reduced appetite and weight loss. So what causes this disorder? The cause of Crohn's disease is still pretty much unknown. Some scientists speculate that infection by certain bacteria such as strains of Mycobacterium may be the cause of Crohn's disease. Crohn's disease is also considered an autoimmune disease. When you have Crohn's disease, your body's immune system begins attacking healthy cells in your GI tract, causing inflammation. Because it is a disease of the immune system, Crohn's is classified medically as an autoimmune disorder. This means that your body is producing antibodies that work against itself. A gene that coexists in both animals and plants that researchers have found that makes someone more susceptible to the disease is found on chromosome 16 and is passed down from parent to child. Around 15% of Crohn's disease patients have this gene mutated. The mutated gene increases the chance of developing Crohn's disease by about 25%. This gene is called NOD2 and is found in cells called monocytes that have the ability to swallow up harmful microbes that invade the body. The gene encodes a special protein that identifies lipopolysaccharides which are found in the outer membranes of certain harmful bacteria. This means the immune system can then destroy these bacteria, preventing them from harming the body. When someone has this gene mutated, the protein is changed, not allowing it to detect the offending bacteria. Due to this, Crohn's disease status as an autoimmune disease morphed more into the idea of it being an immune deficiency according to some researchers. In general, mutations in NOD2 are associated with autoimmune diseases since the gene plays such an important role in the immune system when recognizing bacterial molecules. Jews of Eastern European descent are 4 times more likely to have Crohn's disease according to recent studies conducted by Mount Sinai researchers. Even though NOD2 is heavily believed to be an influence into whether a person has Crohn's disease or not, there is no concrete correlation between a specific gene and an autoimmune disease. Therefore, a Punnett square cannot be made. For diagnosis, your gastroenterologist will perform a physical examination. This includes determining if there is a tenderness or any inflammatory masses present. Then look at your anorectal area for hemorrhoids, anal fissures, or perianal abscesses. The diagnosis process is complex because there is no direct symptoms that determine Crohn's. Your doctor will take blood tests to determine things such as if you have anemia or elevated white blood cell levels. The prognosis can be very severe or not. At the extreme end, some patients may experience only one episode and others suffer continuously. About 13 to 20% of patients experience chronic Crohn's disease. As I researched how the disorder affected one's life and interactions, it seems to be a very stressful disease because the only people who know what you are going through are others with the disease. This is largely due to how much is known about this disease, because in fact, very little is known. Anti-inflammatory drugs are often the first step in treatment after nutrition change, such as sulfasalazine adolphinine and mesalamine acetylrhoeasa, which both treat the colon. Corticosteroids are taken to help reduce inflammation anywhere in your body, but aren't for long-term use, but can be used short-term to improve symptoms and induce remission. There are many different immune system suppressors that also reduce inflammation by targeting the immune system in order to suppress response. Other methods are taken to help relieve symptoms such as antidiarrheals, fiber supplements, laxatives, and pain relievers. Supplements such as iron, B12, vitamin D, and calcium should be taken because of the effects of drugs. Several clinical trials are undergoing for future treatments such as UNITI-1, which will examine how the FDA-approved drug for psoriasis may help in treating patients with Crohn's disease who experience previous treatment failure. Traditional first-line treatment of taking an anti-inflammatory drug to help the system is still a popular option. Blood tests to genetically test for the mutated NOD2 gene are available but aren't necessary because you aren't going to be put on treatment just because you possess the gene. But by doing so and positively testing for the mutated gene indicates higher severity if you have Crohn's. Everyone can be tested for it.